Good afternoon to all. Today we all are gathered virtually to attend the webinar on current trends and nursing practice in armed force hospitals. So good afternoon, ma'am. So I introduce myself Roma Patel, Assistant Professor of Parul Institute of Nursing, Parul University. So now let me introduce your guest speakers and their biography. So she completed BSc Nursing in Army College of Nursing Jalandhar in 2010. After then, she completed MSc Nursing in Nightingale Institute of Nursing, Noida in 2013. And she also joined our Paru University as a PhD scholar. Now I can explain her work experience. The nursing tutor at Heritage College of Nursing in Varanasi in 2010 to 11, HOD of Pediatric Narayana Nursing College in Kanpur in 2013 to 15, nursing officer at Trauma Center at Banaras Hindu University, Varanasi at 2015 to 17, and 2017 commissioned in Indian Army as a nursing officer. Till the date, she promoted to the rank of the captain as a senior nursing officer. So congratulations, madam. So
Thank
now
you.
before the starting the session, I would like to share few instruction with the all the attendance agenda of today's webinar. To introduce to understand the nursing trends in military hospitals, to discuss the autonomy and job profile of nurses, to discuss the various innovative practice follow in military hospitals, to know the research opportunities, and to understand the standard operative procedure and protocols. So I welcome you, ma'am, behalf of Parul Institute of Nursing, Parul University. Now, without further delay, I request you, ma'am, start your presentations.
Thank you, Ruma. Good morning to one and all present over here. This is Captain Neha. Today I will be dealing with the topic that is current trends and nursing practices in armed forces. Nursing is the youngest of profession and the oldest of art. As we all know, that nursing came up in 1888 with the Florence Nightingale when she healed the soldiers in Crimean War. From there, the nursing come up, and from there itself, the military nursing services come up. Military nursing services. Florence Nightingale laid the foundation of military nursing services, offering her services to wounded soldiers during the Crimean War. As she look after the uh, as she look after the wounded soldier only, from there it come up that military nursing services should take care of all the soldiers who are ill. Basically, the military nursing services are dealing with the soldier health as well as their family's health, so that whenever the soldier is working at that time, they don't have any kind of stress for their families and their children. In 1888, Army Nursing Services in India come up. First, 28 March 1888, the first batch of 10 qualified and certified British nurses landed in Bombay to organize nursing in military hospitals in India. Then they designated in 1896 as an Indian Army Nursing Services. In 1902, Queen Alexandra became the first president of the British Army Nursing Services in UK. This is a batch which shows the military nursing services. This is a batch of 1903. In after the World War II victory, the military nursing services come up with more focus, because in after that war they have healed the wounded soldiers. Indian military nursing services is one of the finest, belonging to one of the largest military in the world, rendering care to the tri-services, that is Indian Navy, Indian Army, and Indian Air Force. The military nursing services person or the nursing officers who comes under the military nursing services, they have to work in Indian Army, Navy, and Air Force. The badges over the air. In 1903, we have seen the badge or the logo is like this. In first, you can see the slide, and in nowadays it is the last one. You can see in 1950 what is the change in the logo of the military nursing services. This logo is on our beret, so that it will be you can from far itself you can easy to recognize that this is a member of the military nursing services. The basic aim of the military nursing services is to care for the soldiers of the defense force who are guarding the motherland, ex-servicemen and their families, providing them the comprehensive nursing care. Basically, we are dealing with the soldiers, ex-servicemen. Ex-servicemen means the soldier who have left the service after some years, like after rendering 14 years of service, they left the service. Then they comes under the ex-servicemen. Then at that time also we have to give care to them also, their families and their dependents. The basic motto or the main motto of the service is Saharsh Seva or the service with the smile. As we all know that nursing is a service which which we have to give with a smile. So it is approved by the Indian government in 1975. Military Nursing Service Raising Day is 1st October 1926. This day is celebrated as the Military Nursing Service Day. Organization of military nursing services. Now we are coming towards the main point of the military nursing services, that is how you can join the military nursing services. Military nursing services are basically of two types, that is regular commission and a short service commission. Regular commission means the person who studied from the army colleges or the colleges which are affiliated from the army itself, and after the completion of 4 years of study, they directly get posted into the army hospital. And the short service commission nursing officers are basically joined from the civil. They have done their graduation and post graduation from civil, and after that they join the military nursing services. The difference between the regular commission and the short service commission is the regular commission nursing officer has to render 20 years of minimum service in army, while the short service nursing officer can render maximum of 14 years of service. Okay, like the short service commission is basically for 5 plus 5 plus 4 years. Fine. The person who is joining from the civil, they have to first they have to fill the bond of 5 years. They can fulfill the service of 5 years. And after that, if they want to extend the service, they can again fulfill the fill the bond of 5 years. Then again, if she is interested towards service, then she can fill the bond of 4 years. That means the total of 14 years of service she can render. The regular commission nursing officers are minimum they have to serve for 20 years. Okay, while the short service commission maximum can serve for 14 years. Organization. The main headquarters of Army Nursing Services is at Delhi, and it is the main head of the MNS is Major General. The Major General is the highest post of MNS, and it is Medical Director General. Or she is sitting at the Army headquarters, and she is assisted by the Deputy Director General of Military Nursing Services, who is the rank of the Brigadier. Additional DGMNS is an advisor to DGMN Army. DGMN Army is Director General of Military Nursing Services, Army, Navy and Air Force. The Major General MNS, who is the main head or one governing body of whole MNS. She is the one who is looking after the nursing services in all the hospitals, including Army, Navy and Air Force. She is the one who will pass all the rules and regulations and other factors followed. No other bodies can interrupt her decisions. Right? She is the one and only governing body. Whenever she has to take any decision with Army, Navy and Air Force, at that time she can have a talk with the Director General of Army, Navy and Air Force, and she can make the big decisions if she wants to bring any change in service. She is Major General Sonali Ghoshal. How to join Indian Army as an MNS? For joining the military nursing services, there are basically two ways, as I have told you, that Army trained nursing officer and the civil trained nursing officer. For Army trained nursing officer, there are certain colleges. After your 12th, the candidate have to write the written examination, like we are writing examinations for AIMS and other big colleges of nursing. Like that only we have to write examination for all these colleges of nursing, Army nursing colleges. And first, when the candidate will qualify the written examination, then she undergoes the medical examination, and after the medical examination, she can join the College of Nursing. And after the completion of 4 years of service, she can directly post it to the Army, Navy, and Air Force hospital. These are the candidates. They are basically the regular commissioned nursing officer and civil trained nursing officers. After doing BSc nursing or MSc nursing, one can join Indian Army as an MNS officer through a SSB examination, which includes written examination followed by interview and medical board. After qualifying all the three phases, candidates have to wait for merit list. If qualified in merit list, then she will join Indian Army as an MNS. This is basically for 5 plus 4 years, in which you have to chances to convert in regular commission. Like the nursing officer who is work who will come from civil, she have total two chances to get to convert her joining in permanent commission. How she can convert it? By giving two interviews. Subsequently, her name will come for permanent commission interview. When she will go for interview, she have to qualify that interview, as well as she should have a good ACR, annual confidential report. She should have a good confidential report, and with that, she can get commission. She can get permanent commission in service, and she can come equivalent to the regular commission. Training of nursing officers. Training of nursing officers are basically in the basic nursing officer course and senior nursing officer course. This is 1 month course for newly commissioned nursing officers held in Lucknow. Lucknow, there is officers training school is there in Lucknow, where Army, Navy, Air Force, and MNS all officers trainings are held in that institute only. This is 1 month strict training, in which they'll train you for running, jogging, and cycling, or even uh, gunning and etc. They will taught you. Then duties and responsibility of military nursing services. The duties and responsibility of military nursing services are quite different from the civil. As I worked in civil as well as the central government institute and the army institute, so I can very well tell you the difference between all the three institutions working. Like when you are working in the civil institute, at that time you have seen that there are morning shift and evening shift, and person has to do 5 night duties in 1 month. But in army it's quite different. We have to perform the short duties and long duty alternatively. Short duty is of 5.5 hours, that is from 7:30 hours to 1300 hours, while the long duty is of 10 hours, that is 7:30 to 7:30 at the evening, in which we have 2 hours break, that is lunch break. And then night duties, we have to perform 15 days night duty in every 45 days. And we will get these 4 off in 1 month. So you can see the duties are quite lengthy. Right. When I was working in BHU at that time, I used to work in morning, evening, and that's it. Shift duties are there, and we'll be very happy with those two shift duties. But nowadays, we have short duties and long duties, and long duties is sometimes very hectic because in army, you don't have many nursing officers with you who are assisting you. But in army, you are only one nursing officer has to look after the 50 soldiers who are admitted in the hospital, whether they are on DIL, on SIL, or whatever they are. And if the nursing officer is posted in ICU or NICU, then she will be assisted with a junior person, newly commissioned nursing officer along with her. That's it. So the workload is much. And the duties of MNS officer, what all the duties she should perform and an MNS should perform. Like we have seen in central government institutions, like the nursing officer has to come and she will just do the patient care and she can go. That's it. And she can just do the reporting and recording. But in MNS, what the nursing officer should have to do many things. Like she is the one who is responsible for each and everything in her ward. Like she is responsible for waste management. She is responsible for cleaning of the ward. She is responsible for patient care. She is responsible for administration and ward management, round management, supervision of juniors and subordinates. She is the one who is responsible for diet. Then she is the one who is responsible for all the procedures on the patient, then communication, indent, medical stores, report and records, and teaching also. And one more thing, that is transferring patient from one unit to other. In our hospital, what is there? Like some hospitals are big, they are known as the command hospital, and some hospitals are small, like 200 bedded, 400 bedded. They are the small hospitals, while the command hospitals are 1500 bedded or 2000 bedded, and these are the hospitals. They have the tertiary care hospitals. So sometimes we have to airlift the patients from primary center or secondary center to the tertiary center. At that time, the nursing officer is the one who will lift the patient. And here we have to lift the patient from Assam to Assam to Kolkata, Assam to Bangalore, Assam to Delhi. We have to transfer the patient. At that time, we have to transfer the patient from air by aircraft of the Air Force. And if you are working in army sector, and at that time you have to transfer the patient from ambulance. So this is one. Then terms and condition of eminent officer. What is the eligibility criteria? The person who want to join Indian Army, the candidates who want to join Indian Army, for them I just want to tell you, your nationality should be Indian, your qualification should be BSc nursing or MSc nursing, your age limit should be 20 to 35 years, medical category is shape 1. Shape 1 means you are medically fit, no operations at all. The marital status, you should be unmarried, married, divorced, or widow. Then gender is only female candidates are eligible. Date of commission, whenever you will commission, your date of commission with your name and your service number. There is one number, it is authorized to each and every person who is working in army. They are always, we can, whenever they can be recognized, they have to recognize by their service number only. There is so and so service number is of Captain Neha, right? So your date of commission, your name and your service number will be published in Gazette of India uh, on the year you are commissioned. Then antedate. Antedate means like the person who are BSc nursing, they get 2 years of antedate. Sorry, 1 year of antedate. For like one person join after the BSc, one candidate join after the BSc, and their protocol is like the newly commissioned nursing officer joined as a lieutenant, and after the 3 year of service, she will be promoted at the rank of captain. But if the person joined after the BSc nursing from civil or after the BSc nursing from army college, then she will get 1 year of antedate and she will be promoted to the rank of captain after the 2 year of service. But if she joined after the MSc nursing, then she will promoted to the rank of captain after the 1 year of service itself. The antedate will be reflected in your salary also. It's not like that they will promote you on rank, but they will not promote you with the salaries. But in this, what happens, if after 1 year of service you are promoted to the rank of captain, that day itself your salary of captain will be coming or reflected to your salary slip. Right. Then leave. Annual leave of 60 days per year. You are authorized for annual leave of 60 days per year. You can take casual leave of 20 days per year, maternity leave of 180 days. LTC hometown and other than hometown will be given once in a year. Rank, seniority and promotions. Whenever you will commission, you will commissioned as a lieutenant. Then after the 3 years of service, you will be captain. And as I said, that if you completed your BSc nursing and joined the service, then after the 2 years of service, you will promoted to the rank of captain. And if you completed MSc nursing and joined the service, then after the 1 year of service, you will promoted as a captain. Right. Then after the 8 year of completion of service, you will promoted to the rank of major. After the completion of 14 years of service, you will promoted to the rank of lieutenant colonel. And above the lieutenant colonel posts are on selection basis. Selection is from the army headquarters. As I've told you, army headquarters is there in Delhi, and the major general is the head of the department, and she, along with her subordinates, she will decide the who should be promoted on the basis of ACR, that is annual canon confidential report. Routine of an ambulance officer at 4:30 a.m. to 5:30 a.m. 5:30 a.m. I some mistake is there. PT and running will be there for 1 hour early in the morning, 4:30 to 5:30. Then early morning 7 to 7:30 you have to be in mess for breakfast, and 7:30 to 1300 hours if you are in short duty, and if you are on long duty then 1930 hours you have to be on your shift. Then in short duties at 1700 hours you have to come to the ground for PT, games and running, and at 7:30 p.m. you have to go to mess for dinner, and then 8 p.m. to 10 p.m. meetings will be there, and so you have to attend the meeting. So overall, your routine will be fixed, and you are not allowed to do anything extra, or if you don't have a strength to do anything extra sometimes. So that's why you have to be medically fit. Transfer. In military nursing services, you will have transfer in every 3 years, which include Army, Navy, Air Force hospitals all over the India. If you selected, then you can get 2 year of UN mission posting. UN mission means the friendly missions are there that called the UN mission. For those posting, you have to go to the abroad. You have to go to abroad and you have to work with the people there. And that is a very good posting and exposure for all the nursing officers whosoever is get selected. Then every alternate posting you will get for field posting or border posting. Then war posting in case of any war and disaster, or TD duty in case of any disaster. Like if any war is there in border, so at that time they send us for temporary duty for ward or casualty, or in case of any disaster like the COVID hai. So in COVID scenario, what they did, they send the nursing officer on TD to Delhi, because in Delhi we have our hospital, 1,000 bedded hospital, Sardar Vallabhbhai Patel Hospital for COVID patients, and DRDO hospitals also. So they send the nursing officer there for TD duty. TD is the temporary duty. Higher education. While working in the military nursing services, you are eligible to go for higher education. The nursing officer who are short service commissioned, they can go for short-term courses like ICU course, NICU, pediatric, gynecology, ops, onco, burn. These courses are for all of 6 months or 3 months courses. But if you are PC or regular commissioned nursing officer, then you can go for education like CBBSc, MSc nursing, and PhD nursing for regular candidates. For this, you have to get PC first. PC is the permanent commission. Why to join Indian Army? As from starting onwards, I am telling that working hours are more, and busy schedule is more, and you have border posting and all these things. Yeah. Then why you should join Indian Army? This is the major talk today. So first is the gazette officer. After joining the military nursing services, you will be a gazetted officer. On the day you commission, that day itself you will be recognized as a gazette officer, and your name will be reflected in the Gazette of India, as I told earlier. Okay. Then second is try to be a member of Indian Army. It's a pride to be a member of Indian Army. It may be the military nursing services, your area of work is military nursing services or engineer services or medical services, anything. But you are a member of Indian Army. So it's a pride for yourself. Then dignity with the rank. They will provide you with the rank, and of course the seniority with the rank. So it will be a dignity or pride. Then salary scales, as I have seen that the salary scales in civil started from the 4600 grade pay, right? But in army, whenever you join the service, your starting grade pay will be 5400 grade pay. Okay. And every year the grade pay will be increased by 200. Like in first year of service, your grade pay will be 5400. In second year of service, your grade pay will be 6600. Third year of service, your grade pay will be 6800. So salary scales are good, which is the attractive factor to join military nursing services. Then you will be getting all the canteen facility as well as the hospital facilities. While working in Indian Army, you will have free hospital facility for you and your dependents. You will have free food and accommodation other than the salary. In army, you don't have to spend much for your food and accommodation, as well. An officer is authorized for free food and accommodation, so you need not to bother for your um, accommodation. That every 3 years you will be transferred to another other city, and you have to bother for your accommodation. And for transfer, grants are also given by the Indian Army, as every 3 years you will be transferred from one place to another. So the transportation allowance will be given to you according to the distance. Right. Then not to join Indian Army as an ML. Whosoever they should not join. Like if you are not medically fit, you should not join Indian Army. Medically fit means you have some medical problems, you have some bone deformity, you have some blood disorders, you have some psychological issues like that. And if next, if you are very lazy, so please don't join Indian Army because they will like make you so perfect. So it will be very difficult for a lazy person to be in service because she will go in trauma if she is lazy. Then if you want to be near your family, if you want to be near your family all time, you don't want to go away from your family. If you are going away from your family, you will become psychologically weak like that. So at that time, you should not join Indian Army. You should not think of Indian Army. Because in Indian Army, every time you will have transfers every 3 years, and you will not think that you will get your next posting near your hometown. So, if you are emotionally weak, please don't join Indian Army because the stress level is quite more because all time you are busy with the service only. So, thank you. If anything else you want to ask, any query, you can please ask.
Hello, Neha, my voice is
Roma?
audible.
Ha, yes.
So we have to some queries. So I ask you questions. So what about the entrance exam of the joint armed force nurses?
Entrance examination is basically of your NCLEX, whatever NCLEX books we are preparing. Na? The questions are coming from that book only. If you, and a little bit of English questions and GK questions are also there. 20 marks, like 10 marks English examination and 10 marks GK optional questions will be there, and rest of the 80 questions will be from your NCLEX only. So better to prepare with the NCLEX book. If you prepared whole book of NCLEX, then you will definitely get selected. Entrance exam, written exam is not a problem in Indian Army. Basically, the interview is bit tough. You will be
Yes.
very smart enough to crack the interview schedule because in interview panel they have 8 to 10 persons are there and they all are at the range of Major General of Indian Army and Navy. All three forces are sitting together with the Major General of our MNS, and you have to undergo that interview.
Okay, okay. And the
So
next one
Anthrax
is
is
the
the book.
millet.
Yes.
Okay, okay, explain. Hello. Okay,
Hello,
next one
Roma.
is
Yes.
the yes, yes. Hello.
Yes, Roma, please.
Okay. And next one is the military nursing is open for only for female candidates, which is the
Yes, yes.
gender
Only for female candidates. Only for female candidates.
only for the female
Yes.
candidates are,
Yes, yes, yes. Only for female candidates.
and which need to be brought into the knowledge of appropriate authority.
Pardon, please.
Mhm. Okay. And next one is the what about the performance growth in the military nursing?
Roma, your voice is not clear. Please repeat.
Hello. Yes.
Yes, Roma.
What about the performance growth in the military nursing?
Performance growth in the military nursing services. As I told earlier, that one nursing officer with the strength of 50 patients, so they will make you trained clinically. You will be well versed with the clinical clinical area because they will make you when you are lieutenant, they'll put you with the a major or lieutenant colonel rank personnel in Indian Army, and they will make you trained clinically very well in 1 year of service. And as you talk about the teaching field, so each and every nursing officer, whether she is BSc, MSc, whatever is the qualification, she should take certain classes in hospitals, uh, in education departments. So professional growth is there. And as I told you, that short-term and long-term courses are also there, so they can go for, and according to their choice, they can opt for any course.
Okay, okay. And last one is what is the main role and responsibility for the
Yes.
MNS officers? What is the main role and responsibility for MNS officers?
In my previous slide, it is there role and responsibility. Duties as role and responsibility of MNS officer, as I've told you, that MNS officer has to play many of the roles. Apart from the patient care, as a nursing officer in other fields, we are stick with the patient care, but in MNS, apart from the patient care, we are the one who will see the administration and ward management, ground management, supervision of juniors. Juniors means the like medical assistant and nursing assistants are there, so you have to teach them teach them, you have to supervise them, you have to look after the diet of the patient, you have to communicate with the doctors, you have to communicate with the other departments, like if the patient is going have to go for endoscopy, then you are the one who will communicate with the specialist and send the patient to there. Then indent, like medical store work, you are the person who will do the medical store work also. Then reporting and recording you have to do. Then teaching functions in hospital as well as colleges. If your hospital is attached with some college, then you have to go there and take classes also. And if you have to transfer the patient from one unit to other unit. These are the certain role and responsibility of the military nursing, military nurse, and it varies according to the rank also. But like if you are lieutenant, then you have to work with the senior nursing officer, and if you are captain, you have to work alone in your ward. If you are major, then you have to work in your ward as well as you have to do certain administrative jobs also. But if you are at the rank of lieutenant colonel, then you have to do only teaching job as well as the administrative work. At that time you will not have to come to the wards enough.
Okay, okay, good. And last one is this, some give the brief introduction related UN mission posting. What is the UN
your
mission
your
posting?
your voice is not clear, Roma, please.
Yes. Hello.
Yes, Roma, please.
Yes, Neha, just give some brief introduction related to UN mission posting.
I didn't get you.
UN.
Please.
Hello.
Hello. Hi, Roma.
Uh, UN mission posting. I ask you UN mission
UN mission
posting.
posting, it is very tough posting. Like everybody is behind this posting. Every youngster or the person who have started with the family, they want that posting because of uh, financially this is a very good posting because you will get salary from India also, and you will get salary from abroad also. Like if you get selected in UN mission posting with your ACRs and your with your performance, if you'll get the UN mission
Okay, okay.
posting, then you will have like a very good exposure in abroad. You will have to go there and you have to work there with the members of their member of their army personnel. You will go there and you will not work with the civilians there. Whenever you are going there, you have to work with the army personnel, abroad army personnel. You have to work with them, and this is the posting in which everybody wants that posting. Everybody gives their name for that posting because of
How much period?
financial issues. Yeah,
Okay. How much period given the UN mission
2 years,
posting?
1.5 to 2 years. Once they will send you to UN mission posting, and you will come back to your home after 1.5 to 2 years of completion of tenure, and after that you will come back. So this is quite tough, uh, tough to get because hardly 8 to 10 nursing officer has to go every year, and it is very difficult among 3,000 nursing officers. Your name should come. So your ACR and other things are should be very good. Moreover, you should have PC for that UN mission question. You should have permanent commission.
Okay. Okay, Neha. So I
Yes.
thank is okay. So your presentation is complete. So I thank is small word, not even longer than a second, but is contain a lot of appreciation and quite an in it. And I would like to thank to you making excellent presentation and making the seminar interesting and meaningful to the students also and faculties also. So I thank to all members to join today's webinar. So once again, I thanks to all.
Thank you so much, Roma. Thank you so much, Roma. I would like to tell all the students to please join MNS office, MNS services, and it will be very beneficial for them. Best wishes to all.
Okay, okay. Thanks. Once again,
Thank
thanks.
you, Roma.